Hi guys, today's video is a quickie because I've noticed I've been breaking out a bit more, particularly around the days that I work out, and it's been super humid and sticky in the UK. So I thought I'd put together a routine for you to show you what I do when I start to break out on my back and shoulders in the summer. Now, breakouts in the body are super common. As many as 15% of people who get facial acne also get a degree of body acne too. And it's not that surprising. I mean, the things that can trigger breakouts in the body include, for example, humidity. So tight-fitting clothing, workout environment, hot and sticky. The friction drives the surface skin bacteria deeper into the skin pores, and that can cause irritation, inflammation, and breakouts. Similarly, products that cascade down from your hair care can actually affect the body and trigger breakouts, self-tan, the list goes on. And sometimes it's just a manifestation on the body of what's going on in the face. So hormonally driven due to clogging oil, comedone formation, and then the subsequent inflammatory blemishes or nodules or cysts or whatever pattern of acne you happen to be getting. So the first thing I think about is how I cleanse my skin. And I think it's really worth considering stepping away from perhaps your more typical scented, kind of pleasure-driven shower products and using something with a little bit more oomph. Now for breakouts, the active ingredient that I like to use is salicylic acid. I think that something like the CeraVe Smoothing Wash cleanser for dry, rough, bumpy skin, which contains ceramides, hyaluronic acid, and salicylic acid, is a great option. Won't clog pores. And if you actually leave the cleanser on the skin for a couple of minutes, maybe do something else, wash your hair, brush your teeth, whatever, it allows the active ingredient to get into the skin pores and to have its effect. Then when you're out of the shower, make sure you pat the skin gently dry. There is no need to physically exfoliate with your towel. Breakout prone skin does not like friction, so please press and blot rather than rub. Now, the next thing to think about is something to actually get to the core of the problem, to actually solve this. So you want anti-inflammatory ingredients and you want things that unclog the pores, because like with the face, it starts with clogged pores. Pores get clogged, oil builds up, and then inflammation happens because the bacteria has a party in the blocked off pore. So something like Flawless Neutralizing Gel is my go-to. Now, what I like so much about Flawless Neutralizing Gel is that, firstly, it doesn't contain benzoyl peroxide, which is a highly effective ingredient, but it's just very challenging when it comes to putting it on the body, using it on large expanses of skin, to avoid bleaching clothes, bedding, and towels. That's the first thing. But neutralizing gel contains a combination of salicylic acid and bakuchiol and azelaic acid. So it's really anti-inflammatory. It helps break down those comedones from the comedolytic benefits of salicylic acid. And it helps with the red marks that previous blemishes have left behind. Now, when it comes to dosing for the body, it's important to be conscious of the fact that particularly with the upper back, we're dealing with a large area and we're dealing with skin that is relatively thick. So you can afford to use a bit more product here than you might do on the face. So with neutralizing gel, I like to think in fingertip units, and we like to dose according to surface area. So normally I say that a fingertip unit, which is from the crease to the end of the finger, is sufficient for 2 palms. So essentially a face. Now, if you're treating your upper back, you're probably treating about 4 palms, all right? So you want to use at least 2 fingertip units, and you may well find that your skin has scope for 3 or 4. Now, the nice thing about neutralizing gel is it has lovely slip, which means it's quite easy to spread it over a large area. So something like this. Now, if I was treating my chest, that's the kind of dose I would use. And of course, it's not uncommon to get blemishes on your chest as well if you're troubled by acne. And then I would just dose it again. So 1, 2, 3, 1, 2, 3. So basically you're getting a nice even coverage, and you'll see that that massages in super easily. And that's the right kind of dose for a chest. The chest area compared to the back is much more sensitive. The skin is much thinner, may well have previous sun damage. So you want to be a little bit more careful. So 1 fingertip amount is more than enough usually for the chest. I'd often start off using it less frequently, but the back you can kind of go to town. So 2 fingertips to start off with, building up to 3 or 4, depending on how severe or extensive the problem is. Now, with those ingredients, it's fine to use the product twice a day, or you can combine with the retinoid at night. You want to really get to the root cause, as I said. That means unclogging the pores, so the approach to the body is the same as it is for the face. So of course, if you're using a retinoid, do that at night, and then use your anti-inflammatory product like neutralizing gel during the day. Now, as far as anti-inflammatories go, you can also use benzoyl peroxide. In the UK, that's a treatment called acne side that you can buy at the pharmacist. But in order to minimize the risk of any changes to fabrics, clothes, bedding, etc., I'd recommend using the short contact method, where you apply the acne side gel, which is 5% benzoyl peroxide, to the skin, and you wash it off maybe 10 or 15 minutes later, so it doesn't stay on the skin and you're not at risk of damaging clothes and fabric. It's also a better way to tackle sensitive skin. I'd be really careful about using benzoyl peroxide on the chest. That can be really a tough area to tolerate that active ingredient, but it may well be suitable for the back. Next, you want to think about the other products that you're using on the body. Now, in the summer, you may be moisturizing your skin, you may be using sunscreen, and you want to make sure that the products you're using are not making matters worse and clogging up your pores. So, Dr. Sam's, we've consciously formulated to make everything non-comedogenic. That means our body sunscreen is safe to use on the chest and the back and won't clog up pores. And also our body therapy, which is actively helpful in blemish-prone skin because of that combination of lactic acid, niacinamide, and bakuchiol. So a great one to use if you're on the dry side as well as being blemish-prone. The final thing for you to consider is how you treat the skin in your body. Are you using a backpack or a handbag that is consistently rubbing on the skin and perhaps ties in with the distribution of your breakouts? So common and just worth bearing in mind. So if a backpack is the problem, it might be worth switching to a handheld bag for a while. And similarly, just be conscious of areas that you're getting breakouts on that correspond with really tight fitting gym wear, particularly if you do hot yoga or spin, activities where your body heat really does increase. And the combination of that sweat, friction in a warm, humid environment can just be the thing that tips you over into more breakouts. As a final note, I would say that if, despite those measures, you're still getting a lot of breakouts, you're getting new spots every day, and perhaps they are more deep-seated, they're lasting a long time, they're leaving significant marks behind, or you see any signs of scarring, it's best to see someone who can actually prescribe medication for you. The body can be affected over large areas, and that can sometimes mean that treating topically is just not going to get a handle on it, and you might need to go for something through the oral route, whether that's antibiotics, Roaccutane, spironolactone, any number of treatments that we have on offer for those with more extensive and severe body breakouts. But what I've given you is a good framework to put a plan in place that you can get started with today and should make a big difference. It's certainly helpful when I put this plan into effect for my body breakouts. So I hope it will help you too. Any more questions on this, guys, please drop them down below. Otherwise, have a great day and I'll see you again soon. Bye for now.